Hello, welcome to another edition of J Hopkins Plastic Surgery 2-minute consultation. I'm Dr. Jeffrey Hopkins. In this segment, I will be talking about rhinoplasty, or commonly known as a nose job. For those of you who are unhappy with the appearance of your nose, or perhaps have had an injury in the past with a resultant nasal deformity, perhaps a rhinoplasty is right for you. The procedure can correct deformities such as a nasal hump, a large nasal tip, a broad nose, a wide tip of the nose, and possible other deformities. The procedure is a surgical procedure that is usually performed in the operating room under IV sedation or general anesthesia. The procedure involves an incision inside the nose and possibly an incision in the skin between the nostrils. The nose will be reshaped and a nasal splint will be placed on the nose after the procedure, and there's also a possibility of placing nasal packing into the nose. After the surgery, you should expect bruising, swelling, and some pain. You will be given pain medication and antibiotics after the procedure. You will return to the office in 1 week to have the nasal packing and the nasal splint removed. After that time, you will wear a nasal splint at night for the next 4 weeks. Well, what I see in this patient, she does have a nasal hump that can be corrected at the time of the procedure. She also has what we call a plunging nasal tip, where the tip of the nose hangs lower than the nostrils. Other things that I would correct would be possibly narrowing the tip of the nose, shortening the nose. The wideness of the nose would also be corrected at the time of the procedure. Most likely I would perform the procedure with an open technique, which involves a small incision at the base of the nose in the skin between the nostrils. The scar heals very well and it's inconspicuous. And I think she would achieve a very fine result. Thanks for listening. Please call the office to schedule your consultation. We would love to have you as our patient.